menopause is a major issue for so many women. There are a myriad of symptoms, and they can go across the gamut from hot flashes to night sweats to just having no energy to brain fog to anxiety. I mean, it crosses the gamut. And one of the things that I run into with women who are trying to navigate all of the different symptoms that they're having associated with menopause, we want to, from a physiological standpoint, we want to test and we want to see what's going on, at the biochemical level, what's going on at the cellular level. So we do absolutely want to test your hormone levels just to see what's going on there. I have not found that to be the total picture though. Because I have had women come in who have horrible symptoms and their hormone levels are fine. I've had women who have no symptoms and their hormone levels are horrible. And then we have where the hormone levels are going up and down so much it's hard to know. It's hard to know really where they're landing in that. And it hasn't been always the best way to get results. What I have found is we have to look at like the whole picture. So yes, okay, where are your hormones? Where are your stress hormones? What's your thyroid doing? What's your gastrointestinal system doing? Are there any other areas that are also playing into it? Because again, as we're going through and we're working with so many women, it's very rarely as straightforward as, oh, the hormones are off, let's work on the hormones and they feel better. I wish it was that simple, but it's simply not. Here is what I have seen working and doing this for years. So many women have spent decades taking care of everybody else. They have spent decades of their life trying to stay fit, trying to keep their weight under control, trying to be superhuman and doing so much for everybody else, and they really haven't taken care of themselves. Many of the women I'm running into, they had children and, they never really ever worked to restore their health after having kids. And so here we are now, 20 years later, and they never rebuilt. They never refueled. They just simply got on with their life. And after, not having the proper fuel for a couple days is not an issue. Even a couple months, you'll be okay. But a couple decades, it really adds up. So then whenever you throw menopause and you throw this transition into the human body, that's whenever these women feel like they've lost all bearings. The things that used to work don't work anymore. The things that they have counted on, or the way that they could always count on their bodies to operate, just simply no longer true. So what we do is we just recalibrate. We get a whole baseline, an entire baseline on your entire health. Okay, who are you now on a physiological basis? What is your biochemistry and what needs to shift, and where do we need to address it so that you can feel like the person who you should feel like? Menopause isn't the beginning of the end. It is simply a transition, and it's worse on people who have not been able to really take care of themselves for all of those years, and it's just adding up. I liken it to the tank analogy. Your tank has just been depleted. So now you're at just this bottomed out, empty, running on fumes. And then you expect your body to go through this major transition running on fumes. It's just not going to happen. So we refuel you, figure out where it is that you need to refuel, and then things start to get better. There's a reason why some women just simply they go through menopause and have virtually no symptoms whatsoever. And I've seen time and time again, those women, it's because they're well fueled. They absorb their nutrients, their gastrointestinal systems are working. They are able to, all of their different systems, they have what they need to fuel the transition. And it's really just kind of that simple. It just requires a lot of data points to be able to get the information that we need and to get you there. The other thing that I have found that it's not, with menopause, it's not just like all of a sudden it's menopause. We have to address all these underlying things that have been really building up for years that have just not been dealt with, or you've been told, oh, your test results are normal, but they're normal, but they're not healthy, or hey, we're just going to kind of monitor and watch and see, or maybe there are a few medications that people have been starting that we really need to reverse what's going on there before it has a chance to really get root. So with regards to menopause, my number one advice, and this is advice that I'm having to take myself as I'm getting into those years myself, is you really have to take care of you. You have to get some real data, because you can't just guess, and you can't just keep taking all these random supplements, because it's like shooting at a dartboard in the dark. You don't know what your body needs. You need to ask it, through blood work. And then basically, get the raw data, find out what your body's asking for, and then refuel. And honestly, you'd be amazed. You can start to feel better within 90 days. It isn't years and decades of restoration. 3 months and you can be there. So don't suffer needlessly. And if you are coming into those perimenopausal years, do yourself a favor and start fueling now so that you don't have all of those symptoms. You simply don't need to be suffering.